talk about our first problem. What happens when this door gets stuck? Well, there's a name for that, mitral stenosis. It's when the valve gets all stiff and narrow and it makes it really hard for blood to get through. Now, you might be wondering where this comes from. Most of the time, it's actually a long-term consequence of having had rheumatic fever. What happens is, the fever can cause the flexible flaps of the valve to scar up and basically fuse together. Medically, it's called commissural fusion. You can just think of it like the edges of the door getting glued to the door frame. And that fusion creates a really distinct look. The valve opening, instead of being nice and wide, becomes this little narrowed slit. And doctors have a pretty vivid term for it. They call it a fish mouth abnormality. You can just picture that, can't you? You can see how that would seriously restrict the flow of blood. And the consequence of that stuck door? It's just simple physics, really. You get a traffic jam. Blood just can't get through that tiny opening fast enough, so it starts to back up. And the pressure builds in that left atrium behind it. That chamber has to work way harder, and the pressure just keeps rising. All that pressure has to go somewhere, and that's what causes the symptoms you see here. The very first sign is usually getting short of breath when you exercise. That's dyspnea. As the pressure keeps backing up into the lungs, it can cause high blood pressure there. It can even push on a nerve that goes to your voice box, making you sound hoarse. And in really bad cases, tiny blood vessels can burst, causing you to cough up blood. Now here's the amazing part. A doctor can actually hear this traffic jam just by using a stethoscope. It makes a very specific sound, a low-pitched, rumbling noise that happens when the heart is supposed to be relaxing and filling with blood. It's literally the sound of a struggle, the heart's cry for help.